Hi everyone, Jack here from Health and Balance. I hope you're doing well and you're enjoying some of the content that we're bringing to you this month here on the Glenora Health Hub around osteoarthritis. Today I'm going to be taking a bit of a deeper dive into osteoarthritis and how that relates back to exercise specifically, some of the considerations around exercising with osteoarthritis, and some of the common beliefs and even myths around exercising with osteoarthritis. And so I think it's important to initially establish just what the physical activity guidelines are for everyday people and for those people suffering from osteoarthritis as well. So it is recommended that we complete 150 minutes of moderate aerobic exercise per week, which can be walking, running, cycling, swimming, whatever type of aerobic exercise you prefer. It is also recommended that we partake in 2 to 3 resistance or strength-based sessions per week. And this can also be accompanied by a flexibility or mobility type program. So it goes without saying that yes, there are some considerations about how to exercise safely when you do have osteoarthritis, and there are some considerations about how to partake in those 3 modalities of exercise safely. Today I wanted to focus a little bit more closer on sort of the general relationship between osteoarthritis and exercise, and go through some of the common beliefs and what we now know about how to exercise safely and long term for people suffering from osteoarthritis. And so perhaps the most common term or phrase that we hear when we ask people with osteoarthritis about what they actually think osteoarthritis is, typically people refer to it as that wear and tear type condition, and typically they also believe that partaking in exercise is only going to lead to their bones rubbing together more, exacerbating their symptoms of pain, swelling, and reduced range of motion at that given joint as well. And so justifiably it can be quite hard to educate and also motivate these clients that partaking in an exercise program is actually going to be a really important part of managing their osteoarthritis long term, but also just managing their overall health as well. And so today I want to give you all a bit of an insight into some of the newer research and newer findings around osteoarthritis and why it's safe to participate in exercise, but also some of the effects that exercise can have on not only our pain, but the way we perceive our osteoarthritis in general. And so if we take a backward step and we address the common phrase of wear and tear, what we're seeing through the newest research is that wear and repair may be a more apt way of discussing the principles that occur within osteoarthritis. And the reasoning behind this is because cartilage is actually avascular, meaning that it doesn't have a blood supply. And some of the more important ways of how we maintain our cartilage and maintain cartilage homeostasis are actually mechanical load and stress. And so what this means is that it can actually be a positive thing and a good thing for people with osteoarthritis to load and compress their joints. Obviously this needs to be done within reason and in the supervision of a health professional. And so another issue that we tend to come across when working with people with osteoarthritis and introducing them to exercise is pain. And Dylan in a previous video would have discussed with you the direct relationship between osteoarthritis and how it affects our pain systems and how we perceive pain. But I think it's critically important to appreciate that when exercising with osteoarthritis, pain is okay. And pain also isn't always a direct correlation of our joint or tissue health. And so we do appreciate that those people suffering from osteoarthritis will have that systemic increase in inflammation that will heighten their perception of pain. And so it's really important that we consider breaking down that safety barrier that people will have around exercise to keep them exercising and living their life in general. However, it's also important to appreciate that exercise can actually have a physiological response on some of that systemic inflammation that I talked about before that's associated with osteoarthritis. And what research has shown is that even just 20 minutes of moderate intensity aerobic exercise can stimulate an immune system response, reducing systemic inflammation within the body. And so this shows that through exercise, in this example, aerobic exercise, we can physiologically start to reduce that systemic inflammation and downregulate our pain systems and our perception of pain. But at the same time, this will also be working on breaking down some of those psychological barriers that we may have established around exercise, whether it be negative connotations or even fear due to our osteoarthritis. So ultimately, it's really important that those people suffering from osteoarthritis partake in regular physical activity. And exercise interventions have been shown to reduce all of those symptoms related to osteoarthritis, whether it be pain, swelling, or even reduced range of motion. It can also improve your function and your quality of life as well. But lastly, I think it's really important to appreciate that even with the osteoarthritis, we still need to be meeting those physical activity guidelines each week to maintain our overall well-being and our fitness as well. And so obviously it goes without saying that there is some more information and advice around exercise and osteoarthritis, but today I just wanted to give you guys a real general sense of the relationship that exists between the two. If you do have any further questions, please don't hesitate to contact the clinic or have a chat with your exercise physiologist when you're at Health and Balance. Take care, guys.